The legislative post-audit meeting, Wednesday, March 30th to order. Sorry for being late. I know members will kind of shuffle in here over the next few minutes, and we'll have a quorum, but we're able to go ahead and start. Just want to remind everybody, we're live streaming at noon, and remind members to turn on and use their mics. Just want to thank Brad Smoot's Law Office for providing the good lunch, and Larry Ann. So Larry Ann, we appreciate it very much, and thank you. So, yeah. We'll go ahead and we'll go to our economic impact statement. Matt, go ahead.
Thank you, Mr. Chair, members of the committee. My name is Matt Etzel. I'll be presenting the results of our audit looking at the accuracy of the state's economic impact statements. I supervised this audit. Tanner Rohr and Maury Exline were the team members. Chris Clark was the audit manager. This audit had two questions. The first was to determine if economic impact statements were generally accurate and what impact the Division of Budgets review had on those statements. The second question had us evaluate the appropriateness of a $3 million threshold that triggered a public hearing for those statements. Before I get into the findings, just a real brief overview of economic impact statements, which begins on page 2 of the report. So economic impact statements are really tied to Kansas administrative regulations. As I'm sure you know, in Kansas, state agencies can enact administrative regulations for a variety of reasons, from anything from establishing Medicaid criteria to setting weight limits on commercial trucks. As you can imagine, some of these regulations can have a compliance cost to businesses, local governments, to the general public. So what economic impact statements really try to do is to capture any of those costs or benefits from those administrative changes. So anytime a state agency proposes a new or amended regulation, they're required under state law to complete one of these economic impact statements. In 2018, the economic impact statement process expanded some. So state law now requires agencies to provide much more detail on these statements. That's going to include things like a specific dollar amount for any compliance costs and who would carry those costs. It also required the Division of the Budget to review every economic impact statement to ensure that they are accurate and complete. With that background, I'll move on to our first findings, which begin on page 3 of the report. So again, our first question was whether economic impact statements were generally accurate and what impact the Division of the Budget's review had on them. Overall, we did find some minor errors and inconsistencies in a sample of statements, and we did note that the Division of the Budget did not catch those issues that we found. I'll unpack that briefly for you. We started our review by looking at the Division of the Budget's annual reports from 2018 to 2020. One of the first things that we noticed was that very few of these statements included a compliance cost estimate. So there were about 380 economic impact statements submitted over those 3 years. Only about 60, so 16% of them had a cost estimate. We talked to officials at 9 state agencies about these statements. What we learned through those conversations was that sometimes officials didn't report a cost because they really thought that there weren't any. But other times, officials told us they lacked the expertise or data needed to provide a cost estimate. So in those cases, even if a cost did exist, they weren't necessarily able to report one. So just wanted to start with kind of painting that picture. Very few of these statements that we looked at had a compliance cost to begin with. But for our detailed review, we picked a sample of 23 economic impact statements from 2018 to 2020. From 9 different state agencies, and those agencies are listed on page 4 of the report. And we looked at those 23 statements to determine whether or not they were complete and reasonable. So that would include things like, were all required fields filled in, were responses logical, and were estimates free of any obvious errors. What we found was that a few of those statements did have some minor errors. So for example, the cost methodology in 2 of those statements wasn't detailed enough for us to understand how the agency came up with their estimates. One of the statements was also incomplete in that some of the sections that should have been filled in weren't, and another had an error in its revenue methodology. But aside from those issues, those errors, the other thing we ran into with that sample of 23 statements was that state agencies were kind of inconsistent in how they filled out these statements. So what I mean by that is a few agencies reported state revenue or savings as a compliance cost. When we asked them about this, they basically said, they agreed there weren't any obvious costs in these situations, but they just didn't want to leave those sections blank, so they reported savings or revenue instead. We also found some inconsistencies involving whether to report costs associated with state laws and how best to group kind of several regulations under a single economic impact statement. So we did make a recommendation to the Division of the Budget to develop some guidance here for agencies on how to use its economic impact template to try to clear up some of that confusion. We also evaluated the Division of the Budget's review of these statements, and as I mentioned before, we did find that the division approved those statements that we had flagged as having some of these minor issues or inconsistencies. We also found that the division's review process didn't include two requirements from state law, and for the sake of time, I'm not going to go into too much detail on that, but if you would like more information on what those two requirements were, those are listed on page 6 of the report. I'm going to go ahead and move on to question 2 of our audit, which begins on page 9 of the report. So again, our second question had us evaluate the appropriateness of a $3 million threshold that triggers a public hearing for these statements. So basically, state law requires agencies to hold a public hearing anytime an impact statement had a 2-year cost exceeding $3 million. Overall, we were limited on our conclusions here, and that's really for 2 reasons. First, as I talked about before, very few of these statements, so again, 60 out of the 380, even reported a cost. And the problem with that is we couldn't determine how many of those remaining 320 statements either really didn't have a cost or agencies just couldn't estimate one. The second thing that limited us was that even the statements that did have a cost sometimes reported them inconsistently. So as I mentioned before, it wasn't always clear whether agencies were reporting costs, revenue, or even savings. So for those 2 reasons, we couldn't do a full evaluation of the impact of changing that $300 million threshold across all of those statements. But what I can tell you is that from 2018 to 2020, there were only 2 economic impact statements that reported a 2-year cost exceeding $3 million. So what that means is kind of at a high level, it wouldn't seem like raising that threshold would have much of an impact on the number of hearings held over those 3 years. It is possible that lowering that threshold to something like $1 million could trigger a few more hearings, but even then, we only counted 9 statements during that time that had a 2-year cost between $1 million and $3 million. So again, we couldn't get into a full detailed analysis here, but hopefully that gives you some sense of how adjusting that threshold might influence the number of public hearings that would have to be held. So I kind of went through that quickly at a pretty high level. I'm happy to stand for any questions that the committee might have.
Okay, questions for Matt by the committee? Not seeing any. Do we have officials from the Division of Budget are available for questions? Are there any questions? Senator or Representative Williams.
Thank you, Mr. Chair. So yes, Adam, I'm looking at your responses and the recommendations, and so I wondered if you had actually proceeded yet to look at the template to see if there were any items missing that would be more helpful to the agencies.
Yeah, thank you for the question, Representative, and Adam Proffitt, Director of the Budget. We've done a cursory review. Matt and team reviewed the findings with us, and candidly, there's one of the 2 findings I'm in question with. I think it might already be captured just with different language associated with it. The other one I do think that we've missed. I wanted to make sure that this committee had a chance to hear the findings to ensure there weren't any other recommendations to be added to it before we made any wholesale changes to the template, since it's a big change that all the agencies are using. So as soon as we get done with this and get through the Budget Conference Committee, we will be making updates to the templates, and we will be sending them back out to the agencies.
And Adam, do you think that the agencies are consistently providing their updates for these regulatory changes, or are they doing blanket responses for example, if they change all the rules and regs, are they giving a blanket response, or are they more itemized?
Thank you again for the question. It depends. I cannot think of any, and I see hundreds of these throughout the year. I can't think of any that said, here's a bunch of regulations that aren't necessarily tied to each other. Here's one economic impact statement. I can think of several instances to say, here's a grouping of regulations, itemized, 1 through 12 that deal with the same topic. Therefore, we're going to give one EIS, economic impact statement. So to the extent that they're grouped together under the same topic, yes, we do sometimes get one blanket one. If they're dealing with completely separate topics, I don't recall an instance where it's just one blanket statement.
Further questions? Okay, we'll move on to the foster care audit. Amanda? Do you have Tyson's number? Can you text her? Light on? Okay,
Is it?
there it is.
There we go. We got this. All right. I'll just jump in at the audit questions. So the two questions this audit answered was, are foster care stakeholders following adequate policies and procedures to ensure the safety of children in foster care? And then the second question was, do foster care case management providers have sufficient capacity to provide necessary foster care services? To begin, on page 3, you'll see our answer to the first question, which is we found DCF generally has adequate policies, but practices were not always adequate to ensure the safety of children in several areas. Before jumping in depth into that, I just wanted to draw your attention to page 4. There's a chart that has some main players, organizations, agencies, and partners involved in foster care. For this audit, we focused on DCF and its 4 case management providers. And on the top of page 6, you can see a map of those case management providers in the areas in the state that they service. And then also on page 8, you'll see a comparison between this audit and past LPA audits we've conducted. And then we looked at many of these same areas, so we included that. The first area we looked at was placement appropriateness, and we found that state DCF and case management providers were not always meeting performance outcomes for federal and state safety, placement, and well-being measures. You can see those results on page 11 of the report. There's several charts there. One thing to note is case management providers are meeting performance standards for instances of maltreatment while in foster care. And then the next area of safety procedures we looked at begins on page 13 of the report, and this is monthly in-home visits with foster children and their foster placements and safety assessments. We looked at a random sample of 86 cases since October 2019, and those files are not projectable to the entire foster care population. DCF policy requires that case management workers visit children at least monthly. And our review of those files found that those routine monthly visits are not always happening as required. And DCF also has found this in their file reviews as well. And we conducted a survey of foster parents in the state, and they also reported to us that monthly in-home visits were not always happening. Worker child visits are one of the main ways that case management providers monitor the safety of children in foster care. So a missed visit doesn't necessarily mean a child isn't safe, but it does increase the risk. On page 16, you'll see that we also looked at the sufficiency of those visits. And we found that visits were not always sufficient based on the documentation we reviewed to determine if the caseworker had spent adequate time assessing the safety of the child. And there's more detail there on page 16 of that finding. And again, DCF has found similar findings in their own quarterly file reviews. On page 17, you'll see we looked at communication and urgent response. And generally, we found there's policies and procedures in place to address urgent response to safety concerns and also complaints from foster parents. However, foster parents reported to us in a survey that they are at times confused at who to contact or don't always get responses from case management workers. Page 20 of the report shows our findings on foster parent training. And generally, foster parents reported to us that their training was adequate to address the needs of the children that they are caring for. And then on page 23 of the report, you'll see we also looked at missing and runaway children from foster care and found that DCF policies were adequate. They have a special response team that policies align with best practice and national practice. However, we weren't able to evaluate the effectiveness of that compared to previous policies because of data issues. One issue contributing, or likely contributing to these safety findings was high caseloads. We surveyed case management providers, staff, and many of them reported having caseloads too high to necessarily monitor the safety and perform other job duties, and I'll discuss that more on question 2. And then also data issues may have contributed to these safety issues. In 2019, DCF introduced CareMatch as a database to address previous findings on placement data not being shared across child placing agencies, case management providers, and DCF. However, we found that CareMatch isn't always used to make placement decisions, and that because case management providers and CPAs have to enter the data into CareMatch, it's only as good as the data that is being entered into the system. So DCF also has a number of reports and data available to them, and in the past we've found that they have not always used that data to make management decisions and performance improvement decisions with corrective actions and oversight. However, as of the fall of 2021, DCF has instituted performance improvement plans for the case management providers, which will be monitored through the end of fiscal year 2022, at which time DCF has the discretion to institute penalties for performances not met. Okay, switching gears slightly to question 2 of the audit. Closely related to safety is whether DCF and case management providers have the capacity to provide services to children in care. Question 2 was, do foster care case management providers have sufficient capacity to provide necessary foster care services? And on page 26 of the report, you'll see that our answer to that question is that the state does not always have sufficient capacity, especially for specialized services and needs. We began by looking at foster home capacity in the state, and we found that generally the state has enough foster home placements. However, they may not always be in the communities that they need to be in. We estimated the number of homes available in each county and compared it to the number of children who needed foster homes in each county, since keeping children close to their home communities can be a way of supporting well-being. And we found that 39 counties in the state are either over, at, or close to capacity. Specifically, the map on page 28 of the report, the counties in red, those 19 counties, are the ones that we estimate to be over capacity. Further, even when the state has enough foster homes, stakeholders that we interviewed told us that the state may not always have enough homes for children with complex physical, emotional, or behavioral needs. You can find more detail on that finding and what DCF is currently doing to address those issues on page 31 of the report. For caseloads, we found that generally DCF or case management providers are meeting DCF's expectation of caseloads. DCF's expectation of caseloads is that they not be over 30. And generally, we're finding that case management providers are meeting that. However, that 30 cases per case manager is not necessarily in line with best practice. We found that best practice is 12 to 18 cases per case manager. And you'll see on the figure on page 34, the top graph shows averages, and generally, case management providers are meeting the DCF expectation, but only one is consistently meeting best practice expectation. And then the second graph also shows we found that maximum caseloads sometimes are above DCF expectations as well. Case management provider officials told us that cases get higher than they should be because of staff shortages and turnover, and that COVID and burnout and low pay has made those situations worse. As mentioned, high caseloads affect the ability of caseworkers to do their job as they reported. You'll see on page 35 of the report more detail on how case management providers or case management staff have reported caseloads affecting their ability to do their job. You'll also see at the bottom of page 35 what DCF has done to help address some of these caseload issues. For mental, behavioral, and specialized health services, DCF policy charges case management providers with coordinating services. Although they don't have to necessarily provide them themselves, they coordinate with KDADs, community mental health service centers, schools, private providers. And we found across the state that children may not always receive the services they needed, especially specialized services. This is on page 37 of your report. DCF has found this as well in their quarterly file reviews. And you'll see on page 38 details from our case management survey about specific areas that the state might have capacity issues in, particularly psychiatric residential treatment facilities or PRTFs. And there's a number of other services and waivers that they mentioned in our survey results. And much like safety issues, service delivery and capacity issues are not new, and they point to larger capacity and accessibility issues in the state, specifically staffing of mental health providers, caseworkers. And our survey of them reported that mental health providers don't always have the staff to meet the demand of the children that need it. Again, PRTF is an example of an area where need has increased in recent years, but staffed beds has not. Other reasons and systematic issues that contributed to capacity issues, according to case management staff and foster parents and officials, is paperwork that is cumbersome, repetitive, and needs to be refilled out with a new placement or new move to a new service. Insurance Foster care children are on Medicaid, so providers must accept Medicaid for them to receive service from that provider. And then stakeholders and case management staff also indicated that a lack of general cooperation, collaboration, and communication between all the agencies involved, DCF, case management staff, KDADs, community mental health service providers, private providers, et cetera, led to coordinating and access issues with services. You'll see on page 40 a list of efforts that DCF reported to us that they have instituted to try to address some of these service issues and capacity issues. Page 41, we drew some larger conclusions about continued issues that LPA has seen over the course of recent audits. 42, we did have recommendations to DCF, and their responses are there. They're generally favorable. And then finally on page 44, DCF, TFI, KVC, and Cornerstone submitted responses that provide additional context for performance and some larger history as well. And with that, I'll stand for questions.
Okay, do we have questions? No questions? Got off the hook easy. We have officials from the following are available for questions. Department of Children and Family, KVC Health Systems, TFI Family Services, Cornerstone Care, St. Francis Ministries. Oh, and Laura Howard's here for any questions. Do you have any questions? Senator Thompson.
Thank you, Mr. Chairman. To any of them, I mean, obviously the problems are, you know, with staffing issues, things like that. How short-staffed are we? And do you see any other changes that are necessary to make this? I know it's a very complex situation. I just want to get your general comments on the report.
Certainly. I mean, in terms of my general comments on the report, I appreciate, and then I'll bridge to your staffing issue, I appreciate the work done by Legislative Post-Audit. And I would ask you to look closely at our agency response as well. I think that the auditors did a good job of showing the progress that we're making in the system. And we're very proud of that progress. I mean, reducing the number of youth in care by 15% over the last 2 years, improving placement stability, which has been a huge issue in Kansas. We're not yet at the federal measure of 4.4 moves per 1,000 youth, but we're at 5.4. That's cut from like 9.9. And then the emphasis that we've really placed on expanding the use of relative and kin placements, really increasing that. We set an aggressive measure here in Kansas to have a priority of placements with relatives and kin, which we think are the best placements for youth. 50%, we've increased from about 32% to almost 45%, Senator, in that regard. So, I mean, there are some very good things happening in terms of our performance. That doesn't mean that we don't have additional places to go. I appreciate the references in the report, for example, to some of the capacity challenges that exist, particularly related to specialized services. I think some of the last comments that Amanda was talking about had to do with behavioral health care, some of the workforce challenges. We've worked really hard in that regard. Take, for example, the psychiatric residential treatment facilities that she spoke about. We worked very hard with partners to stand up more beds. And in fact, if we had workforce to cover those beds, there would not be a waiting list for PRTFs today. So lots of work happened. The workforce challenges have hit us. Certainly, we're doing some things. We've done some things internally with our own workforce. Our partners have. And you all during this legislative process are certainly looking at some resource needs that might help us to address some of those workforce pieces. I also think that there's additional work on the behavioral health side as well with regard to meeting some of those most specialized needs. So one of the things that we're working very hard on is adding to our continuum of care so that we're looking to stand up therapeutic therapeutic foster homes as an added capacity in the system, and we're hoping to kick that off in July. We've been working with partners on a work group for some of those youth that have some of those most intensive needs, to have added supports for foster families, to have the training that's necessary, and to have really specialized homes be able to do that. Kansas used to have that 25 years ago and doesn't have that in our continuum of care today. So I mean, a lot of work going on. I think that the report does a good job of showing our progress, but also where we still have some work to do. On the workforce issues, gosh, every single system is challenged by that today. I know, for example, within the budget that folks have been debating right now, there's conversations about some added resources for some recruitment and retention incentives for our child placing agency partners. You've funded some of those supports for us at DCF. I think we'll continue to focus on those areas. But again, I'm very proud of the progress we've made towards those federal outcomes, but I think those areas where we continue to have the most work to do is continuing to fill in that continuum of care, and then to continue to work with our partners during this workforce challenge issue to make sure that we can make progress in that regard too, Senator.
Okay. Senator Ward has a question.
Thank you, Mr. Chair. So in general, as it applies to crisis services, can you give me a general idea of where we stand with that? I'm guessing that it probably varies across the state, the various responses, and then in particular, for those with extra special needs, maybe the autistic or that sort of thing.
Sure. Yeah, crisis services, that's a great question, both as it relates to youth in foster care, obviously, and then more broadly. We're very proud to, last October, as an agency, to have stood up our mobile crisis response for families in Kansas. We use some federal relief dollars. We're working with Beacon Health Solutions. They manage a contact center, and then we're working with partners in the community mental health system to respond to crisis needs. These are not just for youth in foster care, but for any families that have a child in crisis. That might end up being a response that's resolved telephonically. That might involve sending out a mobile response team to respond to that crisis. And then there's also some ongoing supports built to that. So we've got some data on that, and we'll be sharing that with the legislature on a regular basis as that program continues to ramp up.
Well, wonderful. So this is something that we're still building then, is that?
Yeah, the contract's in place. We think there's still some awareness to be done, and you'll in fact see probably next month, again, some additional pushing out of information about that program, some media approaches to make sure that folks are aware that that resource exists.
Representative Williams.
Thank you, Mr. Chair. Secretary, how troubling was this audit to you when you read it, and how did it compare to the last, 5, 6, 7, 8 audits in the past decade? And does your agency review those audits? For the first big question.
We do, Representative. We, through our audit staff and our program staff, we have a regular process where we review all post audits and reports of audits from, federal partners and things like that. And we get regular reports and updates on our fulfillment of recommendations from those audits. So we do have a process to do that. In terms of how concerning the audit was, I would like things in the foster care system to be perfect. They never will be. I guess what I would say is I feel like the report did a good job of showing the progress that we've made. And I think I've referred to that in terms of, some of those data trends, continued safety while in care, that we do twice as well as the national average in terms of kids being safe in care, that kids are not moving around as much, that 83% of youth are getting the services they need. But it did point out where we still have shortcomings. I think those things that I was just referring to. So not troubling in the sense of the audit didn't demonstrate to me anything that we don't know through our own review process, and that I don't feel like we report and talk to the legislature about, the Child Welfare Oversight Committee about. So I think that's what I would say. Progress, still work to be done. And again, no real surprises to us because we have so much data through our federal processes and our internal processes.
Senator Thompson, you got another question?
I do. Thank you, Mr. Chair. I noticed on page 19, one of the big concerns from foster parents is that they don't know who to contact at the agency. And I'm just kind of curious about that. That would seem like a fairly basic thing. Says 64% of the respondents said they don't know who to contact at DCF if they have a concern with case management provider or about case management staff. Is that because of a shortage in the staff or just lack of communication? I'm just curious.
You know, I was interested in that response to the survey too, and there's a couple things that we're doing, that we're going to do in response to this that we put in our responses. One, I want to get more specific information from foster parents. You know, we do case reads to see our visits occurring, those things, but we're going to start doing some random sampling calling of foster parents to see what their experience has been with visits and those pieces, and find out what other issues and concerns they might have. I think the second piece that we want to do is to do some work with our case management providers, the primary contractors, and the child placing agencies to make sure that they're communicating clarity of those roles to the foster parents who are being supported by the child placing agency, but of course the case management provider is managing the child's case. So I think there's some work we can do with those providers, Senator, certainly to help foster parents be more confident about that at the front end when they first come into the system.
If I may, Mr. Chair.
Go ahead.
It seems like there's more of a turnover in the case workers than the foster parents. Am I correct in that? I mean, a fairly stable number of foster homes, but a lot more turnover in the case workers. Is that the situation?
Right now, certainly our workforce challenges are high in child welfare as they are in mental health. You know, we have some turnover of foster homes, but we've not seen huge differences in those trends as we perhaps have with workforce during these workforce challenge times.
Thank you, Mr. Chair.
Okay, further questions? Okay.
Thank you.
I think we're going to be at ease for a few minutes to see if they come back. If they come back shortly, then we'll take up our executive session. I think we're at a holding pattern, right? Okay, so we'll just wait. Thank you for. Representative Toplicker, I'm sorry.
Mr. Chairman, I move to recess this open meeting for a closed meeting pursuant to KSA 75-4319A to discuss matters relating to security measures that protect Parsons State Hospital and Training Center under the justification listed in KSA 75-4319B 12C, because discussion of such matters in an open meeting would jeopardize such security measures, to resume the open meeting in room 546 South at 1 o'clock, and to record this motion, if adopted, as part of the committee's permanent records. So move.
Okay, do I have a motion? Senator Thompson seconds. Any questions or comments? All in favor, please signify by saying aye. Aye. Against, nay? It passes. Go ahead and close the door. I'll shut the mic. Yeah, takes a second to get things rolling. Okay, we'll move on to the consent calendar items. Kristen? Tab A.
Thank you, Mr. Chair, members of the committee. Today's consent calendar is pretty simple. So as mentioned, Tab A has both the approval of the minutes from the March 2nd meeting, and then the second item is acceptance of the performance audits that were presented today, which include the economic impact statements audit and the foster care audit.
Okay, do we have any questions? No? Okay, then it sounds like, is there a motion to object or abstain? Nope. Okay, so the consent calendar is approved. And our next meeting is the 25th, is that right?
22nd,
22nd?
Friday, April 22nd. We will be doing a performance audit topic selection. And then we also have a number of limited scope audits likely that will be ready for that meeting on suspended driver's licenses, our follow-up audit, social workers hired by K through 12 schools, and the tax credit scholarship program.
Okay. We're adjourned then. Thank you, everybody, for making it. I know it was tough.